Good afternoon. Hey, it's Dr. Steve here, and as you guys probably know or hopefully know, we've made a lot of changes in the last year or so, and one of the things that we've done is we've started to bring in more testing services so we can figure out exactly what we need to do. And what's this allowed us to do is to see exactly how, particularly people with diabetes and insulin resistance and high blood glucose levels, to see how these people are improving over time. And what we're finding is, man, like we have the potential to really create massive amount of changes in people's lives. We're having a lot of patients that are able to actually, that have been experienced the ability to actually reverse their disease process, simply by supporting how the body is normally designed to function. It's very and and so when we talk about this, right, looking at everything from insulin resistance, which leads to diabetic, right? If you what's interesting is about 10% of our population is already diabetic, and there's about 35% that's already pre-diabetic. That gives us numbers where almost half of our country today is either pre-diabetic or diabetic. The parts that's scary about that, probably the most scary, is that most people won't even know it, right? And that's what 90% of pre-diabetics don't even know it. And so that's where we really want to encourage people to come to class so people can have, if you're having troubles with increased weight gain, slowed metabolism, if you already have a diagnosis of diabetes, guess what? We can actually start to, what we know is that we've had patients that have been able to reverse that disease process and actually get off all their medications, as well as all the other crap that goes with it, the increased joint inflammation, the weight gain, the fatigue, the brain fog, right? The PCOS, right? The increased degeneration of different joints, the speeding up of the aging of process of your skin, right? Even cancer is related to the same disease processes that are happening that go directly back to our lifestyle. Even Alzheimer's is beginning to be seen as a type 1 diabetes where the brain actually starts to become insulin resistant. So if you have anybody in your life that you know is diabetic, or you know is pre-diabetic, or that's having any of these issues, if you have Alzheimer's in your family, if you have diabetes in your family, you got to get to this class, okay? What I want to show you here very quickly is a patient that very recently, this was just actually from last year when we actually started to test the pre and post when people are going through the various programs, and the programs are actually tailored based upon what that person needs. And this is just a snippet of what we're looking at. However, if we look at May of 2009, this guy he had chronic daily migraine headaches. Between May and September, he lost around 70 to 80 pounds. Okay. When starting, he was on metformin. He was on 3 different medications, totaling over $1,700 per month. Cholesterol medications. He was dealing with daily migraine headaches where he was taking Imitrex every day. Joint pain, inflammation, prescription medication to help to deal with that. And then high blood pressure. And if you look, May of 2009, if it's red, it's really bad, right? If it's yellow, it's not good. And if it's green, we're in those norms. So basically from May of 2019 to September, we made some massive changes in this guy's physiology, and he is doing so much better. The joint pain's gone. He's back to golfing. He feels great. His energy levels are where they should be. And again, that normal range over here. Go ahead and pause that and rewind that if you want to look at it. Again, class is at the co-op at 6:15 on Monday night. I hope to see you there. I hope you to send loved ones, send family members. You guys, this stuff is life-changing. It's not just a quick fix. This is actually restoring health to the human body. Having a diabetes diagnosis is scary, right? And it entails a lot of really poor prognosis if the problem is not truly addressed at the cause. And I can tell you, the medical system is not addressing it at its cause, and that's why people only get put on more and more medication, get sicker and sicker, and have all of these different, very serious long-term consequences. Now, and so share this. I'm going to challenge you to share this and have a conversation, a heartfelt conversation with somebody that needs to hear this. And I want you to tell them to come. If you need to bring them with, bring them with you. That's all I got for today. I hope you guys have an awesome weekend, and I'm looking forward to seeing you soon, hopefully. Have a good day.